It is these more transmissible variants that could drive a third wave of the pandemic. Tonight, Eric Sorensen looks at the delicate balance as we attempt to get back to normal.
There's been a remarkable downturn in COVID-19 cases since January. If only the trend were continuing. It's not. Worldwide, case numbers rose last week for the first time in 7 weeks.
This is disappointing, but not surprising.
The World Health Organization suggests COVID case numbers have stopped falling because people are letting their guard down, government's public health measures are being eased, and COVID variants are circulating.
In Canada, COVID case numbers peaked in early January around 9,000 cases per day and then fell dramatically for 6 weeks to about 3,000 cases a day in mid-February. But they have remained stubbornly at around 3,000 a day since then. So what does that mean? Looking forward, the variants could cause a spike, a third wave. Or as spring comes along, there could be a wavelet, maybe ripples of new cases. And then as we get into summer, the vaccines could start to bring the numbers down, whatever they are, to a more manageable level once and for all.
Modeling from Simon Fraser University suggests some provinces could see a sharp rise in variant cases if more proactive measures aren't taken, such as testing, tracing, and on travel.
We have to worry about places where variants of concern do take off. I think we all share wanting to relax restrictions. I think we need to be careful around variants because they are higher transmission.
Some experts believe case numbers will become less relevant than hospitalizations and deaths. In Canada, the number of hospitalizations has been declining steadily since January, and the same for deaths, from over 160 per day in January to an average of 42 deaths per day now. Still tragic, but getting better. And early vaccines for the most vulnerable should improve those numbers in the months ahead.
Now we know that vaccination can very effectively reduce death and hospitalization. So once you have this intervention, you can now scale back on community restrictions because we're not having as many people being admitted to hospital.
The COVID variants are not going away, but there is optimism that the spread of vaccines will overtake the spread of the virus and make the pandemic manageable by later this year. Eric Sorensen, Global News, Toronto.